Hi guys, welcome back to my YouTube channel. If you're seeing my face for the first time, hi, I'm Eddie. I film about lifestyle, health and career, and I'm filming from Nigeria. Please do well to check out some of my other videos which are already linked up in the description box below, and also do subscribe to my channel so you don't miss out on all the good stuff. Today, as you guys can tell from the title, I'm going to be talking about what happened after school. After I uploaded the video of my signing out of Nigerian University, I received a whole lot of questions like, okay, now that you are done, are you going for your NYSC? When is your convocation? Invite us for your convocation. No. Okay, so are you going to start looking for a job? Are you now a certified scientist? Different kind of questions, and I kept answering those questions, but at the point I got tired of answering people, and I thought to myself, I think people do not really know about medical laboratory science as a profession, as a course, and that is why I am here to spill the tea about medical laboratory science, giving you guys all the details, everything, what to expect during the course of study, what to expect after the course, what is going to happen, how much you earn as a scientist, and also job opportunities where you can work and all. This is something you like to watch, then sit back, relax and join me. The first thing you want to know about medical laboratory science is, what is medical laboratory science? So most times when you go into the hospital, you most likely not meet with scientists. That is because they work behind the camera, and that is why I feel people do not really know about this profession, because most times when they go into the hospital, they are always seeing the nurses and the doctors around. Okay, so medical laboratory scientists are those people that analyze in detection and diagnosis of diseases. So they work with different body samples depending on the symptoms or the signs of what is going on in the patient. That is like the area of concentration. So medical laboratory scientists run analysis on different samples like blood, urine, it can be sputum, it can be seminal fluid, it can be anything, it can be fecal sample, it can be anything from the body. Medical laboratory science is commonly known as the backbone of medicine. Why? This is because they work behind the camera in diagnosing and detection of diseases in samples. Okay, when you come into the hospital, the first thing you see is you meet with the nurses, the doctors, who ask you questions. They do your vital signs, do some things, ask you questions about what is wrong in your body, and then when you start telling them, okay, I have a headache, I have temperature, I feel this, I feel that, they start guessing, okay, could this be typhoid, could this be malaria, could this be this, could this be that. So for the confirmation of what is actually wrong with the patient, without giving like a wrong prescription or whatsoever, they send patient sample into the laboratory. So now this is where the laboratory comes in. The laboratory collects the sample and then run some analysis on it and come out with the results and tell the doctor, okay, this is the result of your patient, this is what is wrong with your patient. So if you are thinking of going to study this course, what should you expect and what are the things you need? You must have been a science student that is done with your secondary school, and you must have passed the 5 basic subjects, which are the mathematics, the English, the physics, the chemistry and the biology. Okay, so as soon as you are done with this, you have your results. What next are you going to do? In Nigeria, the first thing you do is to obtain JAMB form. When you are done with the exam, you've passed the exam, then you obtain form into the school of your choice, the school that you are sure that they are actually offering medical laboratory science as a course. So medical laboratory science is a 5 year course, and also if you are coming in as a direct entry student, you should know that you are going into medical laboratory science profession for 4 years. Okay, now this is why. As a person, I did medical laboratory technology for 3 years, which is a diploma course, and after which I decided to go for my degree, which is the medical laboratory science, and I obtained my direct entry from JAMB, and then also obtained form into the school of my choice. And then I was asked to do the screening. Then happened where they will ask you for so many results, your certificates and all that, and when they've given you the admission, you are going to start from 200 level, because they believe that you already have experience, you already understand a lot of things. So instead of starting from 100 level, you are going to be starting from 200 level. So that's just the difference between someone that is starting as a JAMBite and someone coming in as a direct entry student. So as a direct entry student, you are spending 4 years. Okay, so if you are coming into medical laboratory science, what are the things you are expecting? Now you know that the course is a 5 year course or 4 years, depending on which entry you are using. In 100 level, you're going to be doing the basic science courses which you've done in your secondary school. It's just going to be like in an advanced level. So you're going to be doing the mathematics, the chemistry, the physics, biology, and all that. And then in 200 level, you're going to start with the major science courses, which are like anatomy, physiology, biochemistry, introduction to medical laboratory science as a course. And now 300 level. Okay, so in 300 level, you're going to start with your practical. You're going to be doing the immunology, the histopathology, hematology, chemical pathology, the parasitology, and all that. So the medical laboratory posting is the practical. Fine, you're going to be doing practical in school, then we are going to be doing clinical posting. So what is clinical posting? Clinical posting is that practical that you do in hospital. Like you go into the hospital and then you experience more about how to run analysis and how to do tests on samples. Fine, you are working in your school with practical with samples, but okay, so let me say this. There is actually an association that governs, that controls the activities of all medical laboratory science and scientists in Nigeria. This association is called the Medical Laboratory Science Council of Nigeria. So they expect that each student should at least go for clinical posting for about 16 weeks. I think 16 weeks. 16 weeks in a session. Okay, so they believe that if you are in the hospital, you tend to work with different scenarios, different disease cases compared to when you are in school. Okay, so let's say in school you're working with samples that are like malaria, typhoid, which has the basis, but when you get into hospital, you're going to see more and more disease scenarios. So that is why clinical posting is very, very important. So if you are going into a medical profession, one thing you should have in your mind is that you are going to have to sacrifice a lot of things. Let's say at the end of the session, you're supposed to go for 3 months break like the other courses will do. You might not be given the opportunity to go for that break. You might not be given the opportunity to go for vacation just because you have to do your clinical posting. So most times, most schools use that break opportunity for the clinical posting. It's one of the sacrifices that you make. Now that you've started your clinical posting is part of your course in school, both first semester and second semester. Now that you are done with your 300 level, you are going into 400 level. The Medical Laboratory Science Council of Nigeria expects that you have your first professional exam. So this professional exam, okay, there is something that I omitted. In 200 level, they expect you to get your index number. So this index number is given to all medical laboratory students. Okay, so this number is what you are going to be using consecutively for your professional exams. So if you've gotten your professional, there are protocols and procedures to follow for that. They ask you to submit some of your certificates, O level and all that. I can't remember the procedures right now, but I'm sure of the O level results. In 400 level, you're writing your first professional exam. They want to be sure that you understand everything that you've been taught from your 200 level to 400 level. So now you're going to be writing your first professional exam, which is in 3 parts: the multiple choice question, the practical, and the viva. So the viva is the oral exam. I made a vlog of when I was writing my first professional exam. If you've not seen that video, go check it out. That exam is always for 2 days. You do your multiple choice question in 1 day together with the practical, and then the following day you have your oral exam. You're going to be writing the multiple choice question in all the courses. Okay, now there's something that I didn't tell you guys. Medical laboratory science, like 4 specialties. We have the chemical pathology, the histopathology, the hematology, and the microbiology. So the histopathology, as the name implies, deals with the study of disease tissue, and hematology deals with study of blood. Chemical pathology deals with the biochemical analysis, and also the microbiology deals with microorganisms. These 4 specialties, they deal with different samples, diagnosing different things. Okay, so in histo they deal with tissue, more of tissue. In hematology, more of blood. In chemical pathology, they deal with serum, and this is where you tend to like do tests like your renal function test, liver function test, the hormonal assay, and all those chemical analysis. And then in microbiology, they deal with blood, fecal samples, the sputum, just in diagnosing or detecting diseases that are related to infection, bacteria, virus, parasites, and all that. Okay, so now back to the first professional exam. The first professional exam, as I've said earlier, that is you write the exam in 2 days, the MCQ for the first day and the practical. So now everything that you'll be writing is based on these 4 specialties. You are going to be answering questions based on these 4 specialties, both the practical, the viva, the MCQ. And they expect that at the end of the exam you have like average, so the pass mark is average. Okay, so after the first professional exam is done, then you go ahead with other activities in your 400 level, and now migrate to 500 level. So in 500 level you are going to be specializing, in the sense that you are going to be going into any specialty of your choice. We are still in the medical laboratory science profession. I've told you guys earlier that medical laboratory science are 4 specialties. So you choose between histopathology, chemical pathology, hematology, or microbiology, any specialty of your choice, because they believe that you must have been familiar with all these specialties. You must be sure of which one you are in love with. For me, I specialize in chemical pathology. I don't want to start saying the reason why I choose chemical pathology, but as soon as you are into the profession, you develop love, you develop this affection and feelings for a particular specialty. You might even be in love with everything, and that is why you are in sciences, because at the end of everything, it's not like you are going to get certificates for being a chemical pathologist. You are still going to be collecting your certificate as a scientist. 500 level, you specialize, and you are still doing your you're still doing your clinical posting. And then after the whole procedure, after the whole course of study, after you are done with your exam, your project, the result is out, there is no carryover, there is no problem, and then the board, the Medical Laboratory Science Council of Nigeria, expects you to write your second professional exam. So now, to all the questions that I've been receiving, that okay, now that you've signed out of university, what's up? I'm yet to write my second professional exam. So it is this second professional exam that is going to tell us what's next. So this second professional exam is, as the chemical pathologist that I am going to be writing my MCQ, still MCQ, practical and viva based on chemical pathology alone. So if you're an hematologist, that is where you are going to be writing your exam. If you're an histopathologist, that is where you are going to be writing your exam. The second professional exam is different from the first professional exam now, just because you've specialized. So you're not going to be writing based on the 4 specialties now. You're going to be writing based on your 500 level specialty, that particular specialty that you specialized in. Okay, so I'm yet to write my second professional exam, and that's because my result is not out. I'm not done with my project, and the school is yet to tell us when to write the second professional exam. After the second professional exam, when the result is out, then the school together with the Medical Laboratory Science Council of Nigeria then organize induction. So most times the medical laboratory science students usually do not do convocation. It is more of induction. So the Council of Nigeria inducts students that have passed the professional exam into the profession. This is where you swear in, like an oath, that I so believe, accept to be a scientist. I will do this with my whole heart, chest, and all that. Okay, the Council of Nigeria then inducts the students into the profession with the same. Then you already have your index number, and then you are going to be given a provisional license. Now, after the induction, you are going to be given a license and a logbook. So this license is going to give you the opportunity to go for your internship. It is not easy to be a scientist. It is not easy to be a medical professional. Okay, so now you are going for your internship. What is internship? I don't know if I should use my English to describe what internship is, or I should just check online and give you guys the definition. Excuse me. So according to Google, internship is a professional learning experience that offers meaningful practical work related to a student field of study or career interest. I hope you guys get what I'm saying, like a professional experience. So now you are going for another experience. Usually for 12 months, which is a year, you go for your internship. You go for your internship, and then you tend to learn more skills. You go there to work, to learn experience, and the sweet part of it is that you are going to be collecting money. I'm sure that's kind of relief us. You're going to be getting money, like you'll be paid per month, just like you working and you're earning your salary. That's the sweet thing about internship. So you pick any hospital of your choice that is registered. You either have federal hospitals, state hospitals, or even a private setting. So far they are registered. I think there is a list that has hospitals that are accepted for interns. I don't know. So that is the next thing you're going to be doing after your induction. And then at the end of the year, you go and collect your license, the original license now. And after which you can now go for your NYSC. See all the procedures before someone can become a scientist. Everything now is going into about 7 years. That's the stress, that's the sacrifice. That is the sacrifice. Okay, so after then you then go for your NYSC. And then when you are done with your NYSC, you can choose to do whatever thing you want to do. You are now a certified scientist. You can now work. You can decide to go for your MSc. You can decide to do whatever thing you want to do. Okay, so as a scientist, where are the places you can work? You can work with the National Health Insurance Scheme. You can work with NGOs. You can work with World Health Organization. You can work in the hospital, private setting, state settings, federal settings. You can work with the army forces. Anywhere that has laboratory, you can decide to start producing laboratory chemicals. That's if you are in love with that. You can also decide to be a lecturer. You can go for your MSc, go for your PhD, whatever. You can decide to be a lecturer. You can also decide to start up your own laboratory. This business is a very lucrative one, but it is capital intensive because most of the instruments that are used in the laboratory are quite expensive. So if you want to go into setting up your own laboratory, go ahead. So these are kind of the job opportunities that you get in Nigeria, and you can also choose to leave the country. And then when it comes to income, I cannot say specifically that okay, this is the amount you can earn if you're working as a scientist, but I can just give like a range that okay, as interns you get to earn like about $200 or $240. I will try and check and put it on the screen for you guys. I'll try and simplify it on the screen. I think it's about $243, which is about, as at today, I think $243 is 100,000. So it depends on the establishment. If it is a private setting, if they say they are going to be paying you 100,000 and you are fine with it, you can go ahead. And if it is federal, I think that should be around 110, 120. I'm not so sure about, I'm not being specific because I'm not sure. Okay, so when it comes to states, they also have the way they pay. So I think it depends on states now. Lagos State might be paying you more than Oyo State. It depends on their own way of making payment. Okay, so as an intern, that is the amount you can earn between like $243 upward, depending on the establishment. I've said that before. With this, I think I've been able to go into details about medical laboratory science. If you have any questions, please let me know. My mail is in the description box below. My Instagram handle is in the description box below. Bring in your questions and I am here. I'm ready to answer your questions any day, anytime. If you enjoyed this video, give it a thumbs up. Don't forget to like, share, comment, and subscribe. Thank you guys for watching. Until next time that you're going to be seeing my face again, stay cool, stay calm, and be happy. Bye guys.